Tragic news coming from Massachusetts, where 11 veterans have died at the Holyoke Soldiers Home. Another 11 residents and several staff members have tested positive there. Examples like these only continue to highlight that the elderly, including our veterans, are at very high risk for COVID-19. Joining us is former Secretary of Veterans Affairs, Dr. David Shulkin, and the author of It Shouldn't Be Hard to Serve Our Country, and Seth Denson, who is the author of The Cure, a blueprint for solving Americans' health crisis. Guys, thanks for being on with us today.
Thank you. Glad to be with you.
Well, Dr. Shulkin, you responded in a tweet, the VA coming out saying that they will not administer COVID-19 tests to non-veteran staff members, and that could even be nurses or doctors. You saying that this waiver should be released. Do you have an update on that, or have they said that they will now administer tests at all? Have you heard an update?
I haven't heard an update. I certainly understand the situation that VA is given its legislative authority to serve veterans, and when it comes to the non-veterans that work in their facility, including their doctors and nurses, the strict interpretation is that they are not allowed to provide testing. But you know, these are extraordinary times, and we've seen the White House create waivers to be able to help us do what we need to do to save lives. And this is an example where the VA just has to cut through the bureaucracy, do the right thing. Of course, we need our doctors and nurses who work in VA facilities to be tested. That's how we keep them safe. That's how we keep our veterans safe.
Hey, Seth, let me ask you a question, and I don't mean to Monday morning quarterback this, but over the last several weeks, we've seen this evolution of what we know about the disease in terms of the need for testing, the need for quarantining and self-quarantining, et cetera, et cetera. So how much of this is the disease evolving and us learning, and how much of it is the government not being properly prepared?
Well, I think you got to understand, there are literally hundreds of epidemics that occur every year throughout the world, and it's virtually impossible to be completely prepared for any one of them to expand into what we're seeing today in this coronavirus. And so to your point, Sean, it is easy to Monday morning quarterback this thing, and I'm sure from a political perspective, a lot of people are going to do just that. But what we need to do is focus right now on the things that we can do to get more people tested, more people treated, more people the care that they need. And in the end, let's learn from this. We didn't learn from H1N1 in 2009, and those chickens are coming home to roost in this situation today.
You know, one question.
Go ahead, Sean.
I
was just going to say, Dr. Shulkin, could you weigh in on this as well, whether or not you think that this is the government not being prepared, or whether as a doctor you think that this is the evolution of getting to realize the full potential of this virus?
I think that when we look back upon this, the fact of that we were not prepared for the diagnostic testing will turn out to be the big mistake that we made. And there are going to be a number of reasons and a number of analyses to look at why that happened so that that doesn't happen again. But if you think about it, the very first case that came in the United States on that very day was the first case that showed up in South Korea as well. South Korea implemented widespread diagnostic testing almost immediately. They've been able to contain this, their mortality rate less than 1%. In the United States, we've seen this has just grown because we didn't have the information to be prepared. And I do think this will change the way that we handle health crises in the future. And government's responding about as well as you could hope at this point, but we've been playing catch up all along.
You know, and to your point, Doctor, many criticizing the FDA that they've been too slow. They just came out and said they have approved now anti-malarial drug for COVID-19. Do you think that we should have released the private sector sooner or encouraged them on top of the FDA more than we have?
Well, I think that the government is acting unbelievably swiftly right now, trying to get out of the way in terms of regulations and doing essentially almost rapid approvals of anything that can help. So I'm very grateful for the response that they have at this point. But I think when we look back in January and February, those are the times that we can just look at each day was a wasted day. Not having the information, not asking the private sector for the right help, not realizing that this thing was coming upon us like a tsunami. And unfortunately, now some communities are really paying the heavy price for that.
Seth, let me ask you a similar question, but you mentioned this a moment ago. How much of this relies on the private sector being able to kind of harness itself and go out there and do stuff, and how much of it is being hindered by government regulations? And maybe should the government is the government doing enough to harness the power of the private sector in fighting this?
Well, I think the government's now getting out of the way, but the challenge is the FDA didn't get out of the private sector's way with specific to testing until late February. Matter of fact, the CDC originally came out and said, hey, we want to control the testing. We want to create the test. The private sector stepped up and said they're ready to do it. Then the FDA said, hey, we're going to make you go through the same steps you always do. And the private sector said, well, wait a minute, we're not going to do that. And so finally the FDA gets out of the way. And I think this is a bigger lesson on, in the future, what we're going to need to do to mobilize the private sector where the vast majority of medical innovation and advancement comes from.
Hey, Dr. Shulkin, real quick. Right now, in the last 24 hours, we've started to hear that this could potentially be more airborne. The CDC recommending that we use masks, potentially. Do you think that we've got a lot farther to go in learning about the full scope of this disease?
I do. We do know a lot about coronaviruses. We do know how to break them down by getting rid of that fat layer. But in terms of where they live on surfaces and how they're spread, I think we have to be extraordinarily careful. And the recommendation that everybody wear a mask, while we don't know it's effective at this point, since we're still seeing such a spread, I don't think that's a bad idea. We are going to get further guidance from the CDC, but at this point, I think people need to do what they can to protect themselves.
You know, Seth, real quickly, we heard the CDC say just a month ago that people shouldn't be wearing masks, and now we have everyone trying to jump on to make more masks, obviously for healthcare workers. But why is there a discrepancy so much in this, do you think?
I think there's a couple of things going on here. One is the shortage of masks. So the last thing we want is the everyday citizen running out and buying up as many masks as they are toilet paper. So, I think for reasons of understanding and making sure that our healthcare professionals have access to proper PPE, that the CDC made those comments. The reality is that most Americans don't even understand how to properly wear the mask as well. So, the more that this thing expands and the more that we can get people engaged in understanding what is and isn't causing this and doing their social distancing, I think the better off we'll be in the end.
Thank you, guys. Hey, both of you, I really appreciate you coming on and sharing your wisdom with us. It's extremely helpful at a time like this.